Yes, let's start. Very good afternoon, all present over here. I welcome all viewers in the AIMS webinar. We all are very enthusiastic and curious about various new technologies emerging every day. We are very hopeful and at the same time skeptic about the use of advanced technologies such as robotics and artificial intelligence. Being a health conscious person, like many of us, I always wonder about modern technologies or smart technologies that we use every day. Robotic surgery, health band, and health apps we hear very frequently nowadays. Now the question arises, as are they real? Are they safe? Is there any matter of concern lies beneath the increased use of advanced technologies where health is a major concern? Or we must say health is a major issue over there? So here it comes. Smart healthcare is redefining our future. But what about patient satisfaction? Friends, our today's focus is on smart healthcare. I, Professor Sharmishta Mukherjee, Assistant Professor of Institute of Management Study, host for the day. So, viewers, before I start with the topic, please allow me to welcome our today's renowned speaker, Professor Rupanjali Roy. Professor Roy is a highly enthusiastic academician with around a decade of experience in the educational field and healthcare administration as well. She is holding both graduation and master degree in hospital and healthcare administration from renowned government university. Her academic excellence include various other certification related to healthcare, nutrition, academic writing, learning and development of healthcare enthusiasts. Throughout her career, Professor Roy has demonstrated exceptional communication, interpersonal, and innovation skill. She has been instrumental in planning, developing, and diversifying quality lesson to the student as well as corporate learner. Her professional background include very active and engaging association with some of her prestigious hospitals, namely Medica Super Specialty Hospital, Arantigor International Institute of Cardiac Science, Columbia Asia Hospital, and Narayana Multi-Speciality Hospital. She is also having a socially, scholarly and research paper in her domain published in international journal. I know she is actively working in the field of telemedicine and remote healthcare services. Her diverse background and expertise make her an ideal speaker for today's topic. Please join me in welcoming Professor Rupanjali Roy as she shared her insight on the impact of smart technology in the healthcare industry. So before ma'am start for the speech, I would like to tell something that is, while ma'am delivering her speech, I would request everybody to mute yourself and whatever questions all are having, please you can send it on the mailbox. As on the and other hand, one more thing that is feedback and attendance link will be shared in the question answer session itself. So it is available for 15 minutes. Yes, any somebody raise their hand? Any question? Okay, so it is available for 15 minutes. Those who are sharing their feedback, the link will they will be getting the certificate only. Okay, so ma'am, over to you. Thank you.
Thank you, Sharmishta, for your nice presentation. A very good afternoon to all of you here present. So let's start our journey today's session. So today we are going to discuss about smart healthcare. Now, over the last few decades, we have seen how technology has involved almost every sector, and healthcare is no exception. From medical device, the diagnosis and treatment, to information system that manage healthcare data, health, telehealth that connects to the patient and different providers remotely. Technology has become an integral part of how we care for individuals. Can I have the slides, please? Yeah. So in this webinar today, we are going to discuss about this forum. You can see the technology in healthcare. There are some importance of the patient satisfaction, key technologies that is enhancing patient satisfaction, challenges, as well as we're gonna see about future trends. So before that, we are going to further. Let us discuss about what is technology. Now, before we're going to discuss technology, we need to understand some people believe that technology, it is all related about the machines, whereas some believe technology means materials, money. So people can be involved also. So we need to understand technology is a system which is basically involved with this two broader sense: man, machine, material. These three broader aspects. So, what is technology in healthcare? So, technology in healthcare refers to the use of different modern tools, devices, software, and systems that is used to improve medical care, from diagnostic and treatment to patient monitoring to record keeping. Next slide, please. So this is something uh, we are going to hear to understand about three broader aspects of technology in healthcare. So first one is medical device, information technology, and what we have, telehealth and mobile health. So going to discuss about medical device, what is it? So here we're going to see three important things I can say. First, we know about diagnostic. So from diagnostic, if you see, that is which is in the modern technology which help us to from early and cure diagnosis of diseases. So from commonest to thermometer, stethoscope to the X-ray machine or pacemaker. These are the all earlier concept. Now this is also going on. But now, if I are coming to now, so now to cutting edge innovations like robotic surgery, AI powered machines. Yes. So this is all are coming to the diagnostic tools and or the other. So if I talk about treatment, so nowadays insulin pumps, pacemakers, hearing aids, mechanical prosthetics is also a includes in treatment. And if I talk about monitoring, and we all know whenever we are going for jogging, we are doing yoga, exercise, whatever we are using, smart watches, we have health bands and fitness tracker also. So this device track and record the vital signs of your heart rate, blood pressure, your oxygen level, physical activity, and much more. Next slide, please. So here, I also want to share you the things of that, how medical devices, how this smart healthcare, how it is related with the IT and IT healthcare, IT and telemedicines and e-healthcare. So when we talk about electronic, when we talk about information technology, this is something we are talking about electronic health records. So we know we went, various of us went different times into the hospitals, and what we gonna see, if I check the patient file, the numerous numbers of data of treatment sheets, the care plan, which is a very difficult to manage. right? And this is something which is very difficult to track all the records. So here is the solution, I can say. So what we have, what? Electronic health records. Now, this is something which is revolutionized how patient information is stored and accessed. No longer paper files, healthcare data. It's now it is something which is digitalized. So making it a more accessible and something which is very transferable. So this is something which is related with the information related data. So if now next we need to understand what we mean by data analysis. So analyzing the patient data, we can identify the patterns, predict the disease outbreaks, optimize the treatment protocols, and improve patient, outcomes. So I can share with you the COVID-19 in the West Bengal. We all know about the Arogya Setu, right? So from this, from this particular app, Arogya Setu, you can if you install this particular data, you can have actual idea in your locality how percent of people, how much percent of people are affected from this COVID-19 and all. So if we're talking about now, there are a few apps whenever you are going to the any multi-speciality hospital. They have their specific app where you can install the app. Whatever diagnostic procedure you have went through. That it may be blood test, maybe in your ECG report, MRI report, whatever. All information gathered in the one place. So now it is your question that, ma'am, how can we save? Now, there is so many data. So how can we storage all these things? So here is the session that is called about cloud computing, right? So cloud computing, with the help of this cloud computing, we can now store and access massive amounts of healthcare data from anywhere in the world. And this is something which is good. This is something which is a cloud platform allows the healthcare providers to collaborate, access numbers of borders, offering seamless and secure of the patient information, which is very critical for the global healthcare management. So here we have understood how information technology, from how from the data, how the data analysis, how the electronic health records, these three gets included together. So next we are coming in the telehealth and mobile health. So in the recent years, if we see, so in the COVID-19, I'm actually specifying. So in the recent years, telehealth and mobile health have become a game changers, particularly in the region where access to healthcare is very much limited. So telehealth refers to the use of digital communication tools to deliver healthcare services remotely, while this e-health encompasses different gadgets what we have now, smartphones, tablets for healthcare purposes. So this is something which we have understood the exact idea about of how technology is related with the healthcare. Next slide, please. Okay, so before we are going to this, I want to share with you one video which will help us to understand, just a minute.
In this video, we will describe the top uses of Internet of Things, IoT, in healthcare. The healthcare industry has started adopting the Internet of Things for patient care and tracking their needs. remote monitoring, smart sensors, medical device integration, fitness trackers, wearable biometric sensors, glucose monitors, prescription dispensers, and smart beds are all examples of adoption of Internet of Things in healthcare. Let's look at the top uses of Internet of Things in healthcare. The patient swallows a vitamin-sized tablet, which is attached to a tiny camera, which takes thousands of pictures of the patient's digestive tract, which can be analyzed by specialists to check for diseases such as colon cancer. Machine learning techniques are also used for image processing, allowing doctors to diagnose and treat their patients more effectively. A continuous glucose monitor, CGM, is a device used for monitoring blood glucose on a continual basis. A continuous glucose monitor consists of 3 parts: a small electrode placed under the skin, a transmitter sending readings at regular intervals, and a separate receiver. A rechargeable IoT sensor fixed near the windpipe on the lower part of the neck collects cardiorespiratory signals and sends the data wirelessly to a nearby phone or system. Google has patented a technology of smart contact lenses which contains sensors and microcircuits. These smart contact lenses can detect changes in the eye fluid and aid in the diagnosis of conditions that may require medical intervention. Engineers at the Massachusetts Institute of Technology have designed a pill made from hydrogel with an attached sensor. The pill can stay in the stomach for an extended period of time. The device can be used to track gastrointestinal temperature and ulcers. IoT can be used to fulfill the promise of personalized medicine, which aims to provide treatment based on a patient's lifestyle, environmental, and genetic factors. The future of IoT in healthcare is promising, as consumers are increasingly interested in collecting data about their bodies and learning more about their personal health. From a technical perspective, advances in the miniaturization of electronics have also made it possible to develop smaller devices and sensors that are more portable and suitable for internal use. For related articles and updates, look at the description below.
Okay. Yeah. Yes. So, yes. So from this particular view, of this video, we have understood what is actually IoT and how it is works. Now we are coming to hear about to discuss about the few things which is related with this particular video. So let us discuss about what is the before 90s scenario. So before 90s scenario, which is, if I say, this evolved from basic, simple to advanced and complicated ones. Now, what is this? So let me give an example of a thermometer. Either it is manual or you can use digital also. So we need to one human to read them, decide the importance or the correctness of the data. Then we are going to register them at to appropriate places, and you need to manually record it, all those data. So now suddenly that magic happens after 90s, and when internet started connecting machine, that is, we got IoT device, that means Internet of Things device. So IoT devices are capable to connect other IoT devices that exchanges different data and that can perform predefined activities based on situation. So now when a patient gets increased temperature, the technology can change the atmosphere of the room, provide medication, sending notification to the nurse on the other floor, and the doctor at the other city. So here, if you see the picture, if you see this particular slides, what is something which is we are visible here, that how this healthcare, how this AI tools, it is benefited, or it is what are the parameters if I say. So first you can see over here that is better management revenue. So you can ask me now what do you mean by this better management revenue, right? So that is something we are emphasizing the handling of financial resources within the healthcare system. Now I can give you a very easy example, that is automated billing system. So automated billing system reduce errors in medical billing, ensuring that hospital collect appropriate fees for service rendered. Next, I can give you cost effectiveness. Now, just right now, before we have gone through, that is electronic health records that we call EHR. So electronic health record that reduces the need for manual paperwork, cutting down the administrative cost. And once again, I can say we all know about the telemedicine. So that can also reduce the need for physical infrastructure and resources while providing care to remote areas. Next, I can guess a very easy things I can tell you, that is reduce the paperwork. So EHR is also a system that system store patient data digitally, allowing healthcare providers to access, the information to anywhere at any time, and it eliminates the need for maintain large storage room that we all see whenever you go to the hospital. You see there are another room, the medical records, where all the large number of patient files is stored. But if we follow this, now many of healthcare professions, many of healthcare systems follow these to eliminate the need for the physical storage and for the paper files, and reduce the risk of losing these important documents. Next slide, please. Yeah. So we have understood what is we have seen in this slide, we have understood that 90s, before 90s, and what is now, we understood about the robotic surgery, AI tools, everything. But the topic is related how this AI, how this robotic surgery, are they actually satisfied the patient satisfaction overall? Actually satisfied the patient? So nowadays, if I tell you that this is something which is called patient-centered care. Now, after 90s, the digital and the data revolution started a new era of healthcare, driven by rapid advance in digital technology, information management, and the internet. So as we are connecting the technologies, we have started connecting with the patient irrespective of their different geolocation, social status, as well as health issues and all. So we must acknowledge that modern technology become patient-centered. Next slide, please. So have you heard about smart ICU? So let's see what we mean by smart ICU.
Sister Rekha, bed number 202 patient is going into Brady. Please have a look, sister.
Can I show these potassium? And I'd order an ECG for that patient. Please also ask them to give 50 ml bicarbonate IV stand.
Cloud Physician is India's most accessible ICU care solution, empowering its partner hospitals to embrace the future of critical care. Cloud Physician Smart ICU is a comprehensive patient-centric solution that includes patient admission, daily rounds, emergency management, 24/7 patient management, and assisted daily triage. Patient admission. Rapid assessment of new ICU patients, including a review of the patient's history, vitals, lab reports, and scans, as well as the complete visual examination of a patient. Daily rounds. Daily patient rounds along with the bedside team using Cloud Physician's proprietary platform, Radar, and two-way audio-video communication stream. Emergency management. During any emergency in the ICU, an intensivist is available immediately, any time of the day or night, for real-time support and code blues. 24/7 patient management. Proactive real-time 24/7 patient care, including nighttime vigilance. Assisted daily triage. While ensuring continuity of care, Cloud Physician recommends and oversees protocolized management of every ICU patient.
Are you there morning consultant today? Have to hand over a patient that I saw yesterday.
Thank you for your help last night.
Cloud Physician is the smart ICU solution of the future. Cloud Physician's 24/7 service is supported by a dedicated team of highly trained ICU providers. They become a part of the bedside team and work with them to provide the best collaborative care and assistance no matter the time of day. From daily rounds to critical admissions, this tireless support is always on. With up to 40% reduction in mortality, 40 hours a month of access to critical care training, up to a 50% increase in resource utilization, and enabling up to 3 times increase in ICU capacity, Cloud Physician's Smart ICU experience is a plug-and-play solution that is hardware agnostic and designed for heterogeneous ICUs. Is your ICU a smart ICU?
Okay, so yes, we have an idea that what we know about ICU. This is something which is a very new concept. Yeah. Slide, please. Yeah. So let us discuss about the patient satisfaction, right? So patient satisfaction is basically a critical, metric in healthcare. Metric in healthcare. It reflects how patient perceives their interaction with the healthcare staff, the quality of treatment, and the accessing of the different care. So satisfied patients are more likely to adhere to treatment plans and the trust healthcare providers, which is leading to better outcome. Next slide, please. So what are the key factors which is influencing the patient satisfaction? So first and foremost thing that we know all about the rendered care or the quality of care. Now, this is something the patient expect: high accurate diagnosis, effective treatments, and clear communication from their healthcare providers. Definitely timely access, quick and easy access to healthcare service for routine checkups. Emergencies is a major determinant of satisfaction. So here I can give you a small example of we called initial assessment of emergency. So this is something I can give you how actually patient satisfaction measures, right? So if somebody, there is some emergency cases and somebody comes into the emergency sector, emergency department. So when an emergency patient first enter to the hospital, and when the first any of the doctor or any nurse going to take care, in which time the patient is emergency patient is entered, and in which time the patient is getting first care, that should be within in very minimum the less than 5 minutes, I can say. The time should be less than 5 minutes. So this is a timely access or timely accuracy which we measures in this initial assessment of emergency. This is just kind of example I'm sharing with you all. And yes, the last is what we have, the comfort and convenience. So obviously, a positive hospital environment and easily accessible all the information and reducing waiting times that is contribute to the better overall experience. So there are several technologies which are transforming the patient experience and making healthcare more, accessible, or we can say more personalized and efficient. Let me explain some major parts of this patient satisfactions. Next slide, please. So first, we are talking to the telemedicine and the virtual care. So telemedicine has revolutionized healthcare by allowing patients to consult with doctors remotely. With telemedicine, patient can access healthcare services without going to visit a clinic, which is especially beneficial for individuals in remote areas or those with mobility issues. Next, wearable devices and remote monitoring. Wearable devices, that means we're using the very smart watches, fitness trackers. This all are related with our vital statistics to measure like heart rate, blood pressures, and different activity levels. So this device allow healthcare providers to track chronic condition in real time and provide proactive care. Let me give you an example. A diabetic patient can use a continuous glucose monitor. That just right now I have show you a video where we can see that there is a glucose monitor that to manage the diabetic patient's health condition effectively. So remote monitoring ensure timely interventions, improving overall patient outcomes as well as the satisfaction level. Yes, next I have already discussed with you that electronic health records. This is something which is a smart process of record keeping in healthcare by digitalizing patient information, or this is something which is reduce administrative burdens and allow healthcare provider to access complete or I can say an accurate patient records quickly. Advanced diagnostic tools. Technologies like MRI, technologies like CT scan, genetic testing allow for more accurate and earlier diagnosis. This tool help healthcare professionals detect disease at an early stage, which is leading to timely and effective treatment. Last, what we have, personalized medicine. So personalized medicine is a treatment plan, the tailored treatment plans to individual patient based on their genetic makeup, lifestyle, and environmental factors. This approach basically ensures that the more effective and have fewer, very less, side effects, leading to their higher patient satisfaction. So let us see what are the major benefits we have from this AI system. Next slide, please. So the first we are going to discuss about the benefits. First one is increased access to care. Okay, so increased access to care, it is basically telemedicine and remote monitoring. Let's bring the healthcare service directly to patients, eliminating the barriers such as distance, I can say. So definitely the distance and all of we have seen in this COVID-19 scenario. Yes, telemedicine is something which is developed in the 19th century, I can say the 20th century. But in the 2020, the COVID scenario, we have seen the rapid growing of this telemedicine, right? Which is where very much we are inefficient to go to for this viruses. So telemedicine help us to a lot for any consultations or for the emergency situations. Next is to improved communication. So this electronic health records and digital platform enable seamless communication between healthcare providers and patients, enhancing the transparency and the coordination. Faster diagnosis, advanced diagnostic tools reduce waiting times for test results, allowing for quicker diagnosis and more efficient treatment plans. Also, it helps to cost reduction. Telemedicine visits are often more affordable than in-person consultation, reducing the financial burden on patient. Person consultation that I have told you. If you see, there are many more. If you have seen the Apollo, they have already bring a app where you can direct go through the telemedicine doctor consultation. So whether the physically charges 1,500 for general medicine discussion, for the any general thing for the discussion, for the consultation with the doctors, in the telemedicine they have charges 200 or 400. So yes, next is to patient empowerment. So we have seen the different smart watches we are using in the regular day basis, right? So wearable this kind of devices and health health apps, engaging patient in manage their health by tracking their progress and staying involved in their continuous care. Patients are more likely to adhere, treatment plans, leading to better health outcomes. So these are the major benefits what we have seen. So obviously there are challenges also. So let us discuss about the challenges. Next slide, please. Next slide, please. Yeah. So let us see about challenges. So nothing we can say this in this world is 100% correct or 100% error free. So there are few major challenges we can need to understand. So we have already seen that we are getting around 20 times more data than before, and several problems, organization and governing bodies that are using or working on those data simultaneously. So a patient data become digitalized. There is a growing risk of data breaches and unauthorized access to sensitive health information. Next slide, please. Yes. So we are talking about data privacy, data loss, data theft, or data manipulations, or illegal sharing or selling of data. So some of these are technical issues, while some are related, obviously what I have said. So these are a few of the example of technical issues maybe, or some are related to the moral or I can say the malpractice. However, the government are actively working on that. But this is something we all know, it is a continuous process. You cannot solve this on a one day, right? So next we are coming to the digital divide. So digital divide is something which is not all patients have access to the necessary technologies. If I talk about right now, I have said you that focusing the different things of telemedicine and all. So telemedicine, it is something which is definitely, it's a very good advantage if we have seen. But one more this very what I can say disadvantage of this process, that for the remote peoples, right? Few they don't know, understand, they have the basic phones, but they don't have idea whether if they have using the smartphone also, so they cannot know how to use it properly, right? So yes, so I'm telling that as such as smartphones or the internet also, internet access, right? So this is something is benefited from the telemedicine wearable device, but even not every hospitals are not yet equipped with this, the new technologies or up-to-date technologies. Now, in the sum of situations, the financial, political, and there are some still growth is needed, I can say. But I hope definitely it can be overcome gradually. So for that, all of us need to be habituated and definitely to familiar with these technologies. Unfortunately, there comes the third concern of usability. Advanced technology demands some learning curves of proper utilization. Now, we, the healthcare members, the freshers, the patients, and the family members need to understand why it is important, and the different way to use this different kind of machines, right? So even understanding is not enough. Obviously, understanding not enough. We must acquire the skill required. So this is not I'm not talking about only healthcare professionals. Obviously, it is something for those who are for service, service takers. I'm talking that the patient family. I'm talking. So both the patients and healthcare providers need training to use these technologies effectively. Without proper education, if without proper education, technology adoption may be slow and underutilized. So these are the challenges that requires robust security protocols, affordable access to technology, and not only this, need education, continuous ongoing education and training for all stakeholders. Next slide, please. So what about the future? So yes, we are in the, we can say we are in the future. So, or we are living in the future where we can see there are robotic surgery and all of the things that I have shared with you all, this all are present. So next slide, please. So before this, I want to share with you Apollo's Mumbai, a video. Just a minute, let me share with you all.
People seeking health services here. Every patient who comes here with a medical issue feels satisfied. And this is because of a combination of a wide range of facilities, right from equipment, health professionals, doctors at Apollo hospitals say they can hardly conduct diagnosis without highly advanced equipment, especially for complicated medical conditions. One of the key outstanding tools used here is the robotics that are revolutionizing the health system by enabling what was initially perceived as impossible in an early operation. But due to the technology used here at Apollo hospitals, the disease can be controlled in 1 week. And this is why the
Welcome to Apollo Proton Cancer Center. Of course, you decide whether the patient will benefit from proton therapy. Options contour the target as well as the organs at risk and prescribe a treatment plan. Medical physics team then creates a proton therapy plan that goes to normal structures is restricted. therapy improves local control and therefore outcomes in some situations. It reduces the toxicity of radiation in others and does both in many clinical settings.
Yes. So we are in the future, and yes, the virtual reality. So virtual reality is one of the one of them when we are talking about the future trends. So it's a virtual but proving very helpful in real life world. So VR is being used for patient education, patient management, and reducing the anxiety during the treatment. For I can give you the example of VR environments can help patient relax before a procedure or leading to more positive healthcare experience. So yes, so we have seen just right a video about the robotics. So yes, robotic assist surgeries allow for greater precision, reducing complication and recovery times. So this technology is basically enhance the patient experience by providing more efficient and less invasive treatment option. And yes, that we all are talking about AI. Yes, that artificial intelligence is being used to analyze a vast amounts of different kind of healthcare data, providing insights that lead to early diagnosis and the personalized treatment. So yes, AI-driven tools such as virtual health assistants offer not only data security, definitely it is giving you 24/7 support and improving patient engagement. So yes, friends, technologies in healthcare making it's a smart healthcare, we can say. Now, technology has transformed healthcare by improving access, personalization, and efficiency, all of which contribute, to higher patient satisfaction. And this is something from telemedicine to AI-driven solution. This is something which future of healthcare is focused on provide patient-centered care. And yes, this patient-centered care meets the individual needs of each patient. Thank you.
Thank you so much, ma'am, for such a valuable insight. I really did not thought so deeply till yesterday. I must admit my viewers' friend have got some valuable insight of healthcare technology today. So I request all who have any question to, if you on the chat box. If you have any question, post the chat box. At the same, it's available only for 15 minutes. Time attendance or feedback link has been provided. It is available only for 15 minutes. So please give all your valuable feedback over there. Accordingly, certificate will be issued. Please, ma'am, will answer. Yes, one question, ma'am. Yes, a question has been raised where may AI can satisfy the patient mental need. Very good question.
One more, please.
One more, please. One more, please. Here the question is, may AI can satisfy the patient mental needs. This is a question, very good one. Ma'am will be answering you.
Okay, yes, very good question. So, so there are some things I can say. It's like emotional support. So yes, AI can engage in conversation, providing a non-judgmental space to share your feelings and thoughts. There is mental health management, which is AI powered apps, I can say, which is, guide mindfulness exercise. There are some stress relief techniques, or there are some, there are apps which you give to provide a mental health check-ins. But yes, I cannot say it is something which is 100% give you assurance. But yes, you can support, minimal support you can have from this, this AI, from this AI tools and all.
Anybody has any further question? Yes. Yes. As I'm very new to this, I have a question too. Ma'am, can you please answer me about the data security? How data will be secured over there?
Yes, Shabishta. So I have already shared this in the data security part. So yes, I cannot say that it is 100% secure. Yes, because they are trying the healthcare organization, the private parts of the organization, I can say, the technological peoples. Yes, they are trying their best, for saving this data and all. And as well as not only the private, government is also trying their best level, to safeguards for this data and all.
One more question, ma'am. Mobile health was started at the time of COVID. Now it is off.
Yes, no, I cannot say not right off. It is something which is, yes, sorry, yes, you are, I can say it is something which is started in something which is a 20th century, the early of the, early of 20th century. So still it is, in this 2020 session, the COVID-19 arises. Yes, it is some, that time we have effectively seen of this, the functions of M-Health and all. Still it is present. Still, if you go to the hospitals, you can see. So this all are effective.
Indeed, it is really a very useful session for every one of us. So I think there's no further question, right? Okay. It seems there's one more question. Okay. Thank you so much. So I really, at the end of the session, I really thank some people of some who those who are associated with it. Without them, the session is not going to be a success, or I must say, greater success could not be achieved with them. So I, Professor Sarmishta Mukherjee, want to thank all the members associated with smooth conduction of today's webinar. Especially, I want to thank our speaker, Professor Rupanjali Roy. I want to thank Mr. Sudhir Sharma, President of AIMS. I want to thank all the board members. I want to thank AIMS Secretariat, and last but not the least, I want to thank all the participants who took time to attend such a valuable seminar, or I must say webinar. So I thank each and one of you. Thank you so much.